Sergio Guardia was a pastor at a mega church, the 24,000 member Thomas Road Baptist Church in Lynchburg, Virginia. Maria and her husband were very close with the pastor and his wife. And this photo, what was Pastor Guardia like?
Very charismatic, extremely nice.
And after she
Zuckerberg came to Nigeria this year, 2025, and once again, he saw their greatest problem, electricity power failure. And while he was with Colonel Afolayan, a filmmaker, the power suddenly went off. Mark Zuckerberg was so shocked because he had never been in a country where there is a lack of electricity. At first, he was afraid, thinking that Nigerian Yahoo boys wanted to kidnap him, because he has always banned their Facebook accounts whenever they try to use them for fraud. So here's the proof of the video.
Program was to use the mainstream television or radio in the UK, but everybody was on Facebook, at that time, and this really, helped. And this is Nigeria.
Nigeria is a great country with so many talented people who ought to make the country great, but the level of corruption in the government is now causing these talented citizens.
don't sing because we just want to sing.
The meaning of guys, I changed his nappy and wife so he can grow up making me coffee like a barista. That's what I call an investment. That is what I call an investment because now he's serving gas. Pastors, please get it together.
All right, I have 2:00, so your time, so we will go ahead and get started. This is our last women's health class. So we're at the end of the semester, and so far we've all survived, or it looks like everybody's here signed on. So I'm jealous that it looks nice there. Heidi's sitting outside. It's only 51 degrees here and super windy. So I'm jealous that you can take class outside today. We had snow on Good Friday. It was like wet, heavy winter snow. It was ridiculous. And the only reason it sticks out in my head is because it was my husband's military retirement. And we had the ceremony and the reception, and nobody came to the reception because there was so much snow. Well, not nobody, but very few people came to the reception because of the snow. So all right. So just some housekeeping things. I posted the Peer Eval link. I tried to do it in Canvas, but I did not have the brain capacity to get it to work in Canvas. So it's a Microsoft Forms. I see some of you have already completed it. Thank you very much. Make sure you're reading the questions carefully because some of y'all strongly disagree with everybody in your group. And I think you actually meant strongly agree because the comments don't support your strongly disagree. So just please pay attention to what you're doing when you're filling it out. That is the role of the pharmacist, to pay attention to details. So make sure you're selecting how you want your peers to be evaluated. You must write comments to support. If they're awesome, you must have comments to support that they're awesome. If they suck, you must have comments to support that they suck. All right. I'm not sure if the course evaluations are ready. I emailed Sean and Dr. Park, and I don't know if that's something that might have gotten overlooked, but please be out on the lookout for the course evaluations. While the course is not going to continue in the new curriculum, I am interested in your feedback in my teaching and coordination for my personal growth and what I can do better. The other thing that I'm specifically interested in your course evaluations is if this was an elective, would you be interested in taking it as an elective, and what components would you want to keep, or which components would you want to get rid of? There's less flexibility this year because it was required, but if it were to be elective, is this something that would be interesting to you, and what parts specifically would be interesting? You can either put that in your course evaluation, or you can shoot me an email if you feel comfortable with that. Because we're always trying to explore new electives. I know that doesn't help you all because you already took this, but maybe it's not a woman's health. Maybe it's a special populations course. Maybe it's something else. Let me know what your thoughts are. I'm really interested to hear what you have to say. Okay. Checkpoint 6, there's only a handful of people who haven't completed it. Please make sure you complete it by tomorrow night. I did give a little extra time since I was a little bit late posting it. So let's wrap that up. There is an essay question. Thank you to those who have completed it. I read through your reflections, and I really enjoyed reading the reflections. What you had to say. So there were a lot of very thoughtful reflections, and one that even brought tears to my eyes. Thank you for putting the time and effort into that. I really appreciate y'all. All right, so now we're going to get to the fun part. We're going to watch the PSAs that y'all have been working on for the semester. So a nice light class today, just watching the videos. Before we do that, are there any questions, concerns?
Did you post the grades for the reflections? Or when it's gonna be posted?
For the on the checkpoint, or I'm working through your discussion stuff.
Okay.
That's taking a little bit longer than I thought to make sure that I'm putting thoughtful comments. So that's taking me a little bit longer than I would thought. So that should be done this week. I'm sorry for the delay. I've had a lot of extra teaching this semester that I don't normally have. And like I said, I'm trying to put thoughtful comments. So yep, that will be done this week. All right. So any other questions, comments about wrapping up the course? You all feeling okay right now going into finals? Everybody have a good Easter break, whether you celebrate or not. You got 2 extra days off. Anybody see family or friends or do anything fun? My whole family was here for the retirement, so we did a lot of stuff. But we hiked the Manitou Incline. You should look that up. It is 2,765 stairs. It goes up, it's only an eighth of a mile, but it goes up 2,000 feet in elevation. I almost died. I had been training for it for like a month, probably not long enough, but better than nothing. And my sister, I think she's part mountain goat because she didn't even break a sweat. She's like, this is so easy. The first 200 steps were pretty tolerable. I only had to take a break every 100 steps. But then after that, it was like every 50 steps, then every 10 steps, then every 5 steps. Some of them, and they're not all like even, they're like this and then this. Some of them you had to crawl. I was skeptical when people said they had to crawl on all fours to get up some of the steps. I'm not skeptical anymore. anyways, the views from the top were pretty great. So it's a one and done though.
The draw, will you do it again?
No, one and done. Just like my child, one and done.
Okay.
Is it a hike or what is it again?
Yeah, it's a hike. So we live at the base of Pikes Peak, and the Manitou Incline is railroad steps, and yeah, it goes up part of Pikes Peak about 2,000 feet in elevation. In 1 mile. Let me see. I'll
Is like there's races there, right? In Pikes Peak.
Yep.
Oh,
So, yeah, so the Olympic Training Center is actually here in Colorado Springs where we live, because I did not know this. You probably all do because you're better at anatomy and physiology than me. But training at a higher elevation is like legal doping because you don't have like you don't get enough oxygen, so you're kind of like starving yourself. So then when you go to like the Olympics at a lower elevation, you perform better because you've been training in high elevation with less oxygen requirements. So, uh, let's see. This one is a view going down. Um,
What's going on, Pikes Peak Region Explorers? So, you want to hike the infamous Manitou Incline, but you might have heard some daunting stories and you don't know where to start. Well, my name is Ryan from Pikes Peak Region Attractions, and I'm here to bring you along the journey.
So you kind of saw the stairwell, but yeah, 2,000 steps.
Dr. Ha,
Yes.
how many hours did it take you to make it to the top?
It took us 2.5 hours to get to the top and then 1.5 hours to go down. We didn't go down the steps. We took the trail down because I think my knees would have died. But the record is freaking 17 minutes to get to the top. And there's like 65-year-old men who do it 3 times a day. Why? I don't know. I don't know. The only thing that I could think of the whole time we were hiking is I was like, this is where the song Highway to Hell was written. I'm on the highway to hell. Every step I took, that's all I heard in my brain. But I did it. So there's great hiking out here in Colorado. If you ever come out and visit, let me know. I'll give you some great places to go. Yeah, we started, so it was me, my husband, my sister, and my brother-in-law, and we're like, "Oh, we're all gonna finish together. We're gonna do this together." And my sister just kept going ahead of us. And she said she kept saying she didn't want to be the last one to finish. But then as we got closer to the end, she's like, I want to be the first one to finish. And she just like went and was waiting for us for 10 minutes at the top while we were dying going up those last 10 stairs. All right.
No, my name is Sam. I'm a senior pharmacist. Are you 45?
to 55-year-old woman. If so, let's talk about how you can manage and first recognize the menopause symptoms. Menopause is the natural part of life that marks the end of women's reproductive years. Recognizing the symptoms can prevent the health issues and can improve the quality of life.
Menopause can bring some big change to your body. You may feel hot flashes or wake up in the night sweating. Your period may become irregular and sleeping can get harder. Some women feel more emotional, irritable, or even sad. You might notice sore breath, weight gain, or your skin become thinner. These are all normal signs of menopause, and you not alone.
Let's talk about some considering the actual work. Firstly, exercise regularly. Some exercise that you can do are yoga, walking, swimming, or hiking. These exercises can improve your mood. Secondly, avoiding the consumption of alcohol, smoking, and caffeine. These can worsen your symptoms and disrupt your sleep schedule. Thirdly, hydration. Drinking plenty of water can avoid dry skin and make your body feel great. Fourthly, consuming calcium-rich food like milk, yogurt, and cheese. And do not forget vitamin D foods like tuna and salmon, since these are great for your bone health. Try to avoid spicy food and wear lighting clothing to prevent hot flashes.
For treatment, you can use estrogen tablets. Make sure to take calcium and vitamin D during therapy. Estrogen will slow down the bone loss, and vitamin D help for better absorption of calcium. Also, other supplements such as magnesium seems to be effective to reduce osteoporosis. It can increase bone mineral density and decrease bone loss in patients after menopause. Remember to see your doctor if you have irregular cycles or you have symptoms under age 40, and also if your symptoms are severe and it affects your daily life.
If the symptoms are affecting you or affecting your lifestyle or you don't know how to manage it, do not hesitate to seek for help. Talk to your doctor or visit the local pharmacist or try to find a support group. Remember, menopause is a journey, not a stop sign. Recognizing the symptom or the signs, take control, and live your best life.
Hi, my name is Nyla Smith. I'm an intern pharmacist at Notre Dame of Maryland University. My cohorts, Christian, Carla, Ahlam, and myself, are here in this presentation to help you learn about the vital, unprecedented role that pharmacists play in fertility care.
Let's talk about some fertility myths and facts. You might have heard of something like you can't get pregnant if you have a medical condition such as endometriosis, PCOS, or even irregular periods. That's false. Sometimes patients without these medical conditions may also have trouble getting pregnant. While these conditions do make it more difficult to get pregnant and affect a woman's menstrual period, with help from your healthcare providers, patients are able to find the right interventions and treatments for them that can help them overcome these fertility obstacles. Some of these treatments include intrauterine insemination, IUI, in vitro fertilization, IVF, and even fertility drugs such as metformin.
Let's talk about common causes of infertility in women. Number 1 is PCOS, which is a hormonal imbalance that messes up your cycle. Number 2, endometriosis, which causes pain outside the uterus. Number 3 is blocked or damaged fallopian tube, which egg cannot meet the sperm. And number 4 is when you turn to age 35, your egg count and quality may drop.
So in the case of men, there's some factors can affect the low sperm count, like obesity, like stress, like smoking, alcohol, and there's some treatments can also cause this low sperm count, like steroids, vasectomy, and even environmental toxins.
Pharmacists play a vital role in fertility care. We help patients know how to take their medications correctly, mitigate side effects like bloating and mood swings, and can recommend essential supplements like vitamin D and folic acid, which can support a healthy pregnancy. We also teach injection site techniques and can develop strategies to avoid missed doses. Importantly, pharmacists help with accessing medications that may require prior authorization. Beyond medications, pharmacists also provide an empathetic space. We listen to patients' concerns and then can help them with outsourcing to specialists, group counseling, and single counseling services that may help ease the emotional burden of going through IVF. More than just a clinician, we are your aides in this process, and we want your fertility experience to be as good as possible. Thanks for watching our presentation. Remember, fertility is a complex journey, but you are not alone. Your pharmacist is here to support you and walk with you every step of the way. If you have any questions or want to stop by for a one-on-one conversation, the doors at the pharmacy are always open for you, and we welcome your call. Take care.
Hi, I'm Shawnee Grant. I will be joined by my colleagues, Alicia Pullen and Haiti Garcia, your local community pharmacists. Today, let's discuss medical abortion, a safe and effective option for ending an early pregnancy. Medical abortion involves using FDA-approved medications to terminate a pregnancy within the first 10 weeks. Understanding how it works, its safety, and when to seek medical support can help individuals make informed decisions about their reproductive health. Medical abortion involves using two medications, mifepristone and misoprostol. Mifepristone blocks progesterone, stopping the pregnancy from progressing. Misoprostol, taken 24 to 48 hours later, induces cramping and bleeding to expel the pregnancy. This process is similar to an early miscarriage and is typically completed within a few days.
And effectiveness. Medical abortion is highly effective and has been safely used worldwide for decades. Serious complications are rare, but some side effects like cramping, nausea, and bleeding are most common. It is safer than childbirth and similar in risk to miscarriage. Now, for medical abortions, it's recommended for pregnancy up to 10 weeks gestation. It may not be suitable for individuals with certain medical conditions such as bleeding disorders or ectopic pregnancy. What is ectopic pregnancy? Well, ectopic pregnancy happens when a fertilized egg grows outside of the uterus, most commonly in the fallopian tube. The tubes are the tubes that carries the eggs from the ovaries to the uterus. Because of the fallopian tube is not designed to carry a growing baby, the pregnancy cannot continue normally. How can you access medical abortions? It is available through healthcare providers, telemedicine services, and some areas pharmacies. Laws and access varies by location, so you should check with a trusted healthcare provider or a reproductive health organization. Now, you need to seek medical attention if you experience any severe pain, heavy bleeding, which could consist of soaking more than 2 pads per hour, a fever over 100.4, or signs of an infection, which could consist of foul-smelling discharge.
Medical abortion is a safe and effective option for early pregnancy termination. Understanding the process and knowing when to seek medical care is essential. If you have any question about abortion, its safety, or access, speak with a healthcare provider or visit a trusted reproductive health resource. Your pharmacy is here to help.
Every year, millions of women experience something more than just that time of the month. Painful periods, also known as dysmenorrhea, affect between 2 and 29% of women of reproductive age. For this group, periods bring unbearable pain that disrupts daily life.
It's not just normal pain period. It's a real medical condition that deserves attention.
Hello, Alexis. I'm sorry. I couldn't make it today.
I'm feeling really bad. I have my period that comes today. Sorry.
Hey, Victoria, what's up?
My period just came
Hmm,
and I'm in pain.
my girlfriend gets a period, and she doesn't get that bad.
Well, nice for her, but this is extremely painful for me.
Extremely painful. Okay, whatever you say. I wonder if he actually was being dramatic. Maybe she is in pain. Hey, dude. Been thinking lately, and this might seem a little random, but I just wanted to say that if I ever dismiss your pain when you're in your period, um, I'm really sorry. I shouldn't have done that. Too often, those who suffer are told to just deal with it. But painful periods shouldn't be ignored. It's time to break the stigma around menstrual health.
If period pain is affecting your life, don't suffer in silence. Talk to your doctor. There are multiple treatments available, from lifestyle changes to medication. Don't suffer in silence.
Hey there, we're student pharmacists from Notre Dame Maryland University School of Pharmacy, and today we're here to talk about something super important: emergency contraceptions. Emergency contraceptives are medicines that are used to help prevent pregnancy after unprotected sex or a birth control mishap.
There are several emergency contraceptive medications that can be used for preventing pregnancy after unprotected sex or contraceptive failure. This includes Ella and Plan B one step. Plan B one step is an over the counter medication and it should be used as soon as possible or within 3 days. Ella is a prescription medication and it should be used as soon as possible or within 5 days. The effectiveness of these medications are for Plan B, it's 87% effective, and for Ella, it's 98% effective. It's important to note that obesity can affect the effectiveness of these medications, and you should always contact your provider or primary care physician or pharmacist for any questions.
For emergency contraception, Plan B and Ella are both safe and effective. You might experience mild side effects such as nausea, fatigue, dizziness, headache, or abdominal pain, but these are temporary and usually go away within a few days. However, it is important to note that both contraception are meant for occasional use only, not a replacement for regular birth control. If you are unsure which one is best or right for you, talk to your pharmacy. We are here to help.
Hi everyone. In Maryland, it is easy to get emergency contraceptive without copay and prescription. Individual may need to go to pharmacy or the clinic and ask simply for the plan B and Hila, these both medication are safe and thanks to Maryland contraceptive Equity Act, which is the passed in 2018. So insurance the company must cover over the counter emergency contraceptive pill without the copay and individual are also able to get birth control for at least 6 months without the prescription and the copay, which help them to reduce the visiting hours of the pharmacy.
All right, guys. Emergency contraceptives are medicines that can help prevent pregnancy after unprotected sex or a birth control mishap. Come by your local pharmacy if you have any questions and ask your pharmacist. Let's keep your reproductive health protected.
I'm your pharmacist. If you are pregnant, getting vaccinated is one of the best way to protect both you and your baby. These vaccines like COVID-19, flu shot, and RSV are safe to prevent serious illness. And they don't just keep you healthy, it also protect your baby. By protecting yourself, you're gonna protect your little one too. So please call your health provider today and ask him which one is the right one for you.
And it protects you from a plethora of diseases, for example, flu. So we want to avoid all these diseases. So these diseases can cause symptoms such as low weight for the baby, low weight gain, and even can induce like preterm labor. For an example, another disease which we do have a vaccine for, COVID-19, can produce symptoms similar, which can cause like high fever, low weight for the child, and can also induce labor. And a very important one, RSV, this can cause low lung function and difficulty for the child breathing. So we really want to, give importance to how important it is for the mom and the child to take vaccines. So we believe the best method of protection is prevention, and we want to keep you safe. So that's why we recommend, first of all, keeping up to date on your vaccines, getting vaccinated. We also recommend washing your hands as mostly as possible. We want to keep those hands clean. And if at home, keeping those surfaces clean, we want to keep all of that clean. And when in places, we want to avoid like large crowds and stuff. And in crowded places, you just mask up.
When to see a healthcare provider. So with these disease like flu, COVID-19 and RSV, you should take care of yourself, get some rest, hydration, and sometimes if they give early like antiviral, for example, Tamiflu. And if you very worried about that, you can check with the healthcare provider and he will guide you if there is any high risk.
When you need to see a health provider, if you have very high fever, it is not going down, if you feel some tightness in your chest, or you feel very uncomfortable, then it's time to talk to your pharmacist. Talk to your nurse practitioner, your PA, or your PCP. Just remember, it's all about staying healthy. Remember that vaccinations during pregnancy does not take only care of the mother, it also takes care of the child. Children, newborn babies, depend on their mothers for immunity in the first 6 months of life, and you can give what you can have. Vaccinations like the Tdap and the flu vaccine would help you to not fall sick, but also help you transfer some good immunity to your children. If in doubt, speak with a provider today. You can speak to your nearest pharmacist, or you can visit www.cdc.gov/vaccines/pregnancy for more information.
Hello there, how you doing? Are you pregnant or are you trying to be pregnant? I'm a community pharmacist. I'm here to discuss about medication during pregnancy, an important topic for expecting mothers. Many pregnant women have potential concerns over the medication they are taking, whether it's an OTC, which is an over-the-counter medication, or a prescription medication, due to the potential risk to their babies.
Understanding medication safety is crucial for both you and your baby's health. Knowing when and how to consult your pharmacist or doctor will help clarify any doubts you may have.
Every pregnancy is unique for every mother, so it is very important to consult your pharmacist or doctor before taking any medications. Also, your pharmacist will be there with you or counseling you on how to take the medication properly, appropriate timing, any side effects you could experience. So this is why it's always important to talk with them. Always inform your healthcare providers that you're pregnant so they can take like the safety measures about all the medications that you're taking and counsel you. Others have concerns about taking OTC medications and prescription medications. Some of these OTC medications can be very common, such as pain relievers and fever relievers. Prescription medications can be like very scary for different pregnant women because of conditions such as depression, infections, diabetes. So this can be like really concerning.
Hello, so today we'll be talking about medication that you can use as a pregnant woman. Safe medications like OTC options such as acetaminophen, because of Tylenol, which you can use for pain and fever. Also, you can use doxalamine, vitamin B6 during morning sickness. Also, for your allergies, you can use loratadine, but always consult with your doctor to see if that's the best option for you. Also, prenatal vitamins are they have folic acid, which would be really beneficial so that your child don't have any birth defects. So, talking about medications that you need to avoid while you're pregnant. So there are an OTC medication, which means over-the-counter medications that needs to be avoided while you're pregnant. Those are ibuprofen and naproxen, which we use for pain and fever. This might affect your unborn child's heart rate and blood flow, so it needs to be avoided. Also, cold medications and also cough medications, which contain alcohol and sulfapyridine, also needs to be avoided. Dividing medications like doxycycline, ACE inhibitors like enalapril, ramipril, any acne medications such as acetronine.
For non-pharmacological options, natural remedies such as ginger, saline nasal spray, dietary changes might be safer options for minor issues such as cold, heartburn, and nausea. Also, lifestyle changes like resting, hydration, and proper nutrition can help reduce the need for medication during pregnancy. Key takeaway is that medication safety during pregnancy is crucial.
Always be sure to consult your pharmacist or doctor before starting or stopping any medication.
We're here to support you to ensure that you have a safe and healthy pregnancy.
Hey everybody, we're student pharmacists at MDMU. And let's be real, when was the last time somebody really explained birth control to you? And not just the quick, take this pill every day talk, but like actually broke down all your options, how they work, what the side effects are, and how to get them. Well, good thing is, we're here to help.
Now, let's talk your options. First up, you have the pill. You take it every day, same time. There are two kinds. You have the combination pills that come in estrogen and progestin, and the progestin-only pills. They are very popular and easy to use. Next up, you have the patch. You wear it on your skin like a sticker, and you change it once every week for 3 weeks, then 1 week off. These are very easy to use, very discreet, and easy to remember. Next, you have the shot, like the Depo-Provera. With this, you get it once every 3 months. You want to set an appointment for your shot so you don't forget your appointment.
Okay, we got some more options. You can try the vaginal ring. You insert it once a month, leave it in for 3 weeks, and take it out on the 4th week. And if it falls out, no worries, just rinse it off and put it back in as soon as possible. If you want something more low maintenance, you have the implant called the Nexplanon, which goes into your arm and lasts up to 3 years. Or you have a more long-term option called the hormonal IUD. It's inserted into the uterus by the provider, and it can last from 3 to 7 years, just depending on the brand.
Now that we talk about the option of hormonal birth control, it comes with side effects. Most are minor, but it's important to know what to expect, such as nausea, breast tenderness, body between period, and mood changes. And yes, some people might experience smile weight gain, but it doesn't happen for everybody. Birth control is not for everybody. Most people experience contradictions such as smoking, blood clot, high blood pressure, and certain people might not be safe for you.
True. And although these options are mainly used to prevent against pregnancy, birth control can be used for other things such as clearing up your acne, making your periods more regular and less painful. It can also help reducing the risks of certain cancers like endometrial cancer and ovarian cysts. So yes, for lots of people out there, the benefit actually outweighs the risks.
The good thing is you have options and we're here to help. In Maryland, some pharmacists can prescribe birth control directly. No doctor's visit needed. And just recently, the O pill, a progesterone-only pill, became available over the counter. No prescription required. Whether you're new to birth control or exploring your options, talk to your local pharmacist or doctor. We're here to answer your questions and guide you through your choices and support you every step of the way. Thank you.
Marissa Tomei looks amazing at 59. Here's her number one secret.
Many
All right. These are some of the best videos that I have seen in all the years that we've been doing this. Y'all did excellent work with your creativity, your editing, your presentation. I'm blown away. This was my first time watching them too. I didn't I didn't watch them last night. So excellent work. Yeah, Jessica and her team look like the Power Rangers. We've been watching a lot of Power Rangers at our house. Power Rangers Dino Fury. It's like and they all come in like that and part like that. Somebody's asking me which one is my favorite, and I imagine that this is much like having multiple children, is that you never really tell them who the favorite is. So, we'll just leave it at that. We can vote, and I can give a prize to the class favorite if we want. I'm seeing some head shakes. Okay, so,
Jose is shaking his head.
yes or no?
Yeah.
Okay. So you can private message me. I think maybe I can do a poll here real quick. I probably can.
You cannot vote for your own, right?
No, you cannot vote. Yeah, that's a good rule. I like that. You cannot vote for your own.
All right.
Host tools. All right. Well, we'll just have to put it in the chat and then I'll have to tally them after. Luckily, ChatGPT is really good at analyzing the chat. So, all right. So we have menopause, fertility. Not even typing all the choices in, and all these votes are coming in. So those are the choices for the topics. All right, so make sure you put your vote in. But I do want to commend you all. Again, these are the best that I have seen. I didn't see hardly any reading. Y'all were talking to the camera. Y'all had very creative ideas for how you told the story, factual. I like the graphics that you incorporated. I don't know that I could create a video with graphics like that. So I feel like I've finally become that old person that I just don't know how to do those things. So I'm super impressed with the graphics that you put into the videos. Y'all did great. Well, I'm not going to answer these questions out loud, y'all. So, because I'm proud of everybody. All right. So make sure you get your vote in. Make sure you take the time to do your peer eval, finish your checkpoint if you haven't. Look for the course evaluation and complete that. Feel free to send me an email of things you liked, didn't like, tell me to go jump off the Manitou incline, whatever. So you are paying me for another hour, so I'm happy to hold you hostage and tell you more stories. I have lots of them, or you can feel free to take off and do what you need to do to get ready for finals. Finals are next week, right? So I want to thank you all for your hard work this semester in this class. I know it's not a priority, but I do appreciate your time and attention to the course, and hopefully you learned a lot of good things that make you a better pharmacist. I hope you have a great summer if I don't see you, and looking forward to seeing you next year in cardio and renal.